everyone, welcome to our lesson on insulin administration and diabetes management. Understanding the endocrine system, types of diabetes, and the correct procedures for insulin injection are critical for healthcare professionals. This lesson will provide you with the necessary knowledge and skills to effectively manage and treat diabetes. To start, we need to understand the endocrine system and its role in insulin production. The endocrine system regulates a wide range of bodily functions through the release of hormones. It is composed of various glands that produce and secrete hormones, which do things like regulate metabolism, maintain homeostasis, regulate levels of calcium in the blood, and regulate blood sugar. The two hormones that regulate blood sugar, insulin and glucagon, are produced by the pancreas. A patient is diagnosed with diabetes mellitus when the body does not produce enough insulin to appropriately regulate blood sugar. Diabetes mellitus is classified as either type 1, insulin-dependent diabetes mellitus, which occurs when the autoimmune system destroys insulin-producing cells, or type 2, non-insulin-dependent diabetes mellitus, which involves insulin resistance and sometimes reduced insulin production. Type 1 diabetes is typically diagnosed in childhood, and type 2 diabetes can be diagnosed either in childhood or in adulthood. Three classic symptoms of diabetes mellitus are hunger or polyphagia, thirst or polydipsia, and frequent urination or polyuria. Over time, diabetes causes damage to tissues and organs, especially the heart, kidneys, and eyes. It is extremely important that patients with diabetes receive the appropriate treatments. Many mild cases of diabetes can be managed through a controlled diet and exercise. Oral hypoglycemics are often used when diet and exercise don't maintain a normal blood sugar. However, when these measures are not enough, drug therapy with insulin is indicated. Sometimes a person's diabetes is severe enough that the patient will take both insulin and an oral hypoglycemic drug. Insulin comes in various forms, including rapid-acting, short-acting, intermediate-acting, and long-acting. Each of these forms have different onset action times and duration action times. In other words, they all vary based on how quickly they take effect and how long their effect lasts. Rapid-acting insulin has an onset of action of 10 to 15 minutes and a duration of action between 3 to 8 hours. Short-acting insulin has an onset of action of 15 to 30 minutes and a duration of action between 30 minutes and 12 hours. Intermediate-acting insulin has an onset of action of 1 to 3 hours and a duration of action of up to 18 hours. Finally, long-acting insulin has an onset of action of 1.5 hours and a duration of action of up to 24 hours. Insulin is most commonly administered through injections using a syringe, insulin pen, or an insulin pump. Inhalable insulin is also available for some types of insulin. Insulin cannot be given orally as stomach secretions destroy it. This lesson focuses on injectable insulin through insulin pens. Insulin is commonly injected subcutaneously, which means a short needle is used to inject insulin into the tissue layer between the skin and the muscle. The best areas on the body to administer a subcutaneous injection are the upper arms, the outer upper thighs, and the abdomen below the ribs and above the hip bones. It is important to consistently rotate injection sites, as injecting in the same place repeatedly can cause lipohypertrophy, or the accumulation of fat cells under the skin. As the tissue at the injection site thickens, lumps of fat can form around the site and can slow the absorption of insulin into the bloodstream by as much as 25%. Another potential issue is lipoatrophy, where the fat beneath the skin's surface can become depleted. Neither of these conditions are life-threatening, but they can cause an increase of insulin resistance at the injection site, resulting in less stable blood glucose levels and requiring higher doses of insulin over time. Now let's look at the procedures for the different routes for administering pre-dosed insulin injections. Regardless of the medication, its form, or its route for administration, you should always follow these basic protocols when preparing medications. Observe hand hygiene. Double-check the patient information to make sure you are giving the medication to the correct patient and to be aware of potential allergies. Refer to the Medication Administration Record, or MAR, to see when the medication was last administered. Obtain the required medication in the correct dose and check the expiration date, and gather any equipment needed to administer the drug. AccuChecks are generally completed prior to insulin administration. Check the blood sugar results of your patient. Know your facility parameters in regards to when to hold insulin based on blood sugar results. To prepare to administer pre-dosed insulin from an insulin pen, first gather your supplies: the insulin pen, a new pen needle, alcohol swabs, and a sharps disposal container. Remove the cap and inspect the insulin for any discoloration or particles. If the insulin appears cloudy, gently roll the pen between your hands to mix it. Attach a new pen needle to the insulin pen by peeling off the protective seal and screwing it on. Remove the outer needle cap and keep it for later. Remove the inner needle cap and discard it. In order to prime the pen, dial up 2 units of insulin by turning the dose selector. Hold the pen with the needle pointing upwards and tap the side of the pen to remove air bubbles. Press the injection button completely to release the 2 units. A drop of insulin should appear at the needle tip, indicating the pen is primed. If not, repeat this step until insulin is visible. Next, you should ensure the patient is in a comfortable position. Inform the patient of the medication they are receiving and its purpose. Choose an injection site in the abdomen, thigh, or upper arm, and clean the area with an alcohol swab. Allow it to air dry. Turn the dose selector to the number of units prescribed. Pinch the skin at the injection site. Insert the needle at a 90-degree angle. Press the injection button down completely and hold for 5 to 10 seconds to ensure all insulin is delivered. Release the skin. Pull the needle straight out. Do not rub the injection site. To dispose of the needle safely, immediately place the used needle in a sharps disposal container. Do not reuse needles. Finally, document the insulin administration in the patient's medical record, including the time, dose, type of insulin, and injection site. Dispose of all used supplies according to facility protocol. Remove gloves and perform hand hygiene. After administration, observe the patient for any signs of hypoglycemia or adverse reactions, especially if the patient is new to insulin therapy or has had a change in dosage. Ensure the patient has access to a meal or snack if appropriate to prevent low blood sugar. For insulin administration, it's important to know when the peak insulin effect will occur and monitor more closely at this time for hypoglycemic reaction. Remember, after completing any medication administration, regardless of route, be sure to record it in the patient's medical record, including the time and any observations. You should observe the patient for any immediate adverse reactions or side effects and ensure that the medication is achieving its intended effect. In summary, insulin therapy is used in the treatment of diabetes mellitus. Insulin comes in various forms, such as rapid-acting, short-acting, intermediate-acting, and long-acting. Insulin is most commonly administered through injections using a syringe, insulin pen, or insulin pump. Insulin pens are the simplest form of administration, as they come in pre-dosed pens that do not require the healthcare worker to draw the insulin from a vial.